celebrations of 5, 10, 15, 20, 25, and 30 years. They were celebrated last Friday at an event called Decode Honors, and we were able to celebrate them in-house during our staff meeting on yesterday. So just want to bring that to this board's attention. Of course, we are also grateful for all the hard work of our dying team. As you saw in the health director's report, there was an impact report toward the end on pages 12 and 13, and that really spoke volumes about the great work that they're doing. And also just really want to continue to really lift up all staff and let them know their value and how much they appreciate it. Next Friday, they will have a retention bonus in their paychecks, and that is definitely doesn't go a long way of really showing how much we appreciate them, but every little bit helps, especially for Christmas. That's all I have, Madam Chair.
Okay, great. Thank you so much. Wow. Thank you, staff. I can't say enough how much y'all are just the bomb. I don't know how else to express that. The end of the year, it's been another long, tough year, and you all are still out here grinding and doing great work in public health. So, like I said, I can't thank you enough. Okay, so next, Dr. Jenkins is going to come to us with a communicable disease update, and then Bria Miller is going to give us a summary of the state of the county health report.
Thank you, Chair Jackson. Good evening, Board of Health. I'm going to try to share my slides here. So it says, I see a host disabled participant screen sharing. There we go. Okay, are you all able to see my slides now?
Yes.
Okay. So I know we've got a full agenda, so I'm going to go through these quickly. I'll certainly entertain any and all questions that y'all have after I'm done, or you can, interrupt me and ask questions. Also, I'm available by email if, additional questions come up after the fact, but I am cognizant of the time here, so I'm going to try to go through this pretty quickly because we got a full agenda. So I'll give a brief update on COVID and then monkeypox, and then we'll kind of get into the more usual just updates on communicable diseases that we typically talk about every year. And then just real briefly at the end, just talk about some of the successes and challenges of the year. So just a quick update on COVID. So as of today, we've had over 96,000 total confirmed cases of COVID in Durham County since the COVID pandemic began, as well as 369 COVID-related deaths. You can see as of a week ago, our 7-day average, or over the previous 7 days, the hospitalizations, confirmed new cases and percent positivity. Just a couple comments on those numbers. The hospital admissions, that data is a little bit tough to interpret because a hospital admission, a COVID-related hospital admission includes hospital admissions that were for other reasons, like someone goes into the hospital because of acute appendicitis and is incidentally diagnosed with COVID. So that does happen. What we're seeing now more is people getting COVID, particularly older folks or folks with a number of underlying medical conditions. So let's say they've got chronic congestive heart failure or COPD, they get COVID, that tips off their chronic medical problems, resulting in a hospitalization. And so that is related to COVID, but the majority of the hospitalizations is dealing with the chronic medical condition. So these hospital admissions aren't what we used to see early on, where it was people coming in and ending up in the ICU, with COVID pneumonia or on the floor with COVID pneumonia. So it's a little bit more of a mixed bag. Regarding the percent positivity, this has uptrended over the past month. So I think, that's notable, and although not surprising given that we're in December in the midst of our triple-demic of COVID, flu, and RSV. With that said, we're still in the green community level, and the 3 metrics used to determine community levels really have stayed stable over the past few months. And so we aren't really seeing a huge uptick in cases and again, hospitalizations. Here you can see just a kind of a screenshot of where we're at as far as COVID vaccinations and boosters. So you can see the blue bar is percent population that has received 2 vaccines, and really starting at age greater than 12, the majority of the population has received at least 2 vaccines, and that number generally goes up as the ages get older. That third vaccine, most of those are boosters. In the yellow bar, you can see, starting around age 30, the majority of the population's gotten their booster. And then, as the subsequent boosters are, we're reporting on the subsequent boosters, you can see those numbers do go down. But overall, about 70% of Durhamites are fully vaccinated, and about 50% have gotten at least 1 booster. Moving on to Mpox, previously known as monkeypox. You can see here, as of yesterday, we've had almost 30,000 cases diagnosed in the United States, including about 20 deaths related to monkeypox. I don't know any, specific details about those deaths, but probably the majority, if not all, occurred in people who were severely immune compromised. That's typically what we've seen. People that really, they get very sick are immune compromised. And this data is a little bit older, from October, but you can see there have been, a couple dozen cases, confirmed cases of Mpox in adolescents, and then some in children, but a very, very small minority of cases in that age group, but some. I'm not going to speak specifically about Mpox numbers in Durham or demographics, just because they're a small number, and the kind of sensitivity of those few cases, but the demographics in Durham largely mirror the overall demographics across North Carolina, and so I've highlighted some of that here. So this data is about a week old, but you could see almost 680 cases of Mpox have been diagnosed in North Carolina since since monkeypox arrived in May of this year. And then highlighting a couple kind of important demographic information. So 96% of cases in males. You can see the majority of cases in individuals between the ages of 30 and 49, followed by cases among individuals 18 to 29. So those two age cohorts make up over 90% of cases. And then a couple, I think, really salient numbers: 67% of cases in Black or African Americans, and over half of cases in people living with HIV. And on the right side, you can see kind of a bar chart of cases by week. So you can see, cases peaking in the summer and then really pretty dramatically declining in the fall. We are still seeing new cases, but not a lot. Our last case in Durham was the end of October. So we've gone about six weeks without a case in Durham. And then here on the bottom, you can see the counties where, the majority of cases have occurred. So, Wake and Mecklenburg have seen the majority of cases, and then in that kind of slightly lighter shade of green are kind of that next tier of cases, which include Durham. Just a little bit more information on Mpox. So we are still vaccinating people who are interested and meet indications for the Mpox vaccine in the Health and Human Services building. Vaccine clinics open Monday through Friday. We take walk-ins, or you can schedule an appointment. And since we started vaccinating July 12th, we've vaccinated over 3,300, or we've provided 3,300 vaccinations. And one thing that we're proud of here is per capita, we've vaccinated more people than any other county in North Carolina. You can see the table here. We're ahead of the counties where we've seen the majority of cases: Mecklenburg and Wake, as well as Buncombe, who's done a really good job vaccinating as well. So This is something that we're proud of. So moving away from COVID and Mpox to some of the other communicable diseases that we tend to talk about every year. So chlamydia, you can see, so that the data for chlamydia, gonorrhea, and syphilis for 2022 is through the end of October. So we don't have data yet for November and December. So you can see here, it looks like cases are down in 2022. If you extrapolate to include, the cases we expect for November and December, case numbers probably are going to be about what they were last year, maybe a teeny bit higher. And you can see that, like in the other previous 4 years, females are overrepresented in chlamydia cases, as are people who identify as Black or African American. You can see on that left chart. And then by far the biggest age cohort where we see cases are those who are between the ages of 18 and 29. Similarly with gonorrhea, you can see cases are, cases look like they're low in 2022. Now with gonorrhea, if you extrapolate the expected cases for November and December, we may see fewer cases than we saw in 2021, certainly fewer cases than we saw in 2022. Unlike chlamydia, we see gonorrhea more often in men. But like chlamydia, Black or African Americans are overrepresented, and we see the majority of cases in that same age cohort, 18 to 29. Now, the one maybe silver lining here, I've just told you, we probably aren't going to see a huge drop in chlamydia and gonorrhea cases in 2022 compared to last year. The only upshot is we are testing a lot more. So you can see this is only Durham County data, so I don't have county-wide data, but if we can extrapolate that testing countywide is probably increased as well coming out of COVID. We are testing a lot more than we were the previous 2 years, but not seeing a lot more cases. So I think that is reassuring. If we were testing a lot more and seeing a proportional number of increased cases, then we're saying, okay, we're testing more, but we're seeing a lot more chlamydia and gonorrhea. We're not seeing that. So to me, that's a bit of a silver lining.
Just one second, Dr.
Yeah,
Jenks. Someone needs to mute. I can't see, I can only see your screens. I don't know who, but someone needs to check their mute. Okay, I think they did it. Yeah,
Thank
thanks.
you, Chair Jackson. Moving on to syphilis. So you can see here, early latent and primary syphilis cases do seem decreased compared to last year. And that again is even accounting for the missing data from November and December. Secondary syphilis cases are about the same as they were last year. And you can see here, like gonorrhea, syphilis is overrepresented in men compared to women. And again, overrepresented in Black or African Americans. Unlike chlamydia and gonorrhea, we really see a pretty good distribution of syphilis diagnoses across age groups. So really between ages 18 and 60, we see a fair number of diagnoses. So it's not just restricted to that 18 to 29 age demographic. And then like chlamydia and gonorrhea, we are testing more than we were, certainly more than 2020. And then testing is up from 2021 already, even just through October. And again, that to me is a silver lining, especially since our cases of latent syphilis are down. Latent syphilis, by definition, you're asymptomatic. And so that's picked up during testing, primarily asymptomatic screening. So the fact that cases are down despite increased testing, I think is a silver lining. Now with HIV, we get this data from the state, and they don't give it to us until the next calendar year. So we won't get our 2022 data until probably mid 2023. So I don't have any 2022 numbers, but for 2019, 2020, 2021, you can see a little bit of up and down in cases across those 3 years, but HIV cases, new HIV cases, largely stable. across those 3 years. Now, as far as rates of new diagnoses, we are ranked 10th in the state over those 3 years. That we did drop from 6 to 10 this year compared to last year. So a little bit of a change. Tuberculosis, we generally treat 10 to 15 active cases a year here. According to this chart here, we have five cases in 2022. We've had a couple more new cases over the past month. So in reality, our numbers are going to be a little bit higher, but it does seem like it's a little bit, it's a year where we're seeing a little bit less TB than we usually do. And as far as foodborne illnesses, pretty much all down except for shigellosis, and these are pretty, sporadic outbreaks, and so I wouldn't read too much into that. But overall, besides shigellosis, all cases of all the other foodborne illnesses are down. Vector-borne diseases, again, are sporadic. So, a couple cases of malaria, which are imported. So people that, got malaria elsewhere, usually abroad, and then came back to Durham County and were diagnosed. Ehrlichiosis, you can't get that in North Carolina. You can get it, quite a number of other states as well. So I don't know if those were imported or if those cases are people that got ehrlichiosis here in North Carolina. Pertussis, we haven't seen a case since 2020, so 2 years without a case. So, kind of overall, I think things that, we've done well this year, continuing to vaccinate against COVID. When Mpox popped up in May, we really, I think, did a good job rapidly setting up our vaccine efforts, including vaccinating here, as well as collaborating with community partners to get people vaccinated. We've increased STI testing in our adult health clinic, as well as through health education, and continue to do STI screening in our refugee health clinic, which we'll hear about in a little bit. The other thing that I don't have time to talk about, but would be happy to talk about sometime in the future, we did start an HIV PrEP, so a pre-exposure prophylaxis quick start program here, where people that are at higher risk for HIV, we'll get them started on medication same day here in our STI clinic, and then make sure that they get connected to a provider elsewhere, like primarily through Lincoln, but sometimes through UNC or Duke or their primary care physician to continue prescribing PrEP. And we've seen a lot of excitement and a lot of demand from the community for this. And so happy to present this data when we have it at some point in the future if y'all are interested. And then some of the challenges we talked about, chlamydia, gonorrhea, incidents largely stable, although again, with the caveat that we are testing more, which I think is a good sign that our numbers haven't gone up. Next steps, continue vaccinating against COVID. We're continuing to vaccinate against monkeypox, although those numbers are down. And the one thing I like to remind everyone about monkeypox when I talk about vaccination is this is a vaccine preventable disease. So in my mind, any Mpox case is one too many, and so we're going to continue to try to get the word out for folks that are interested and meet the indication to get the Mpox vaccine. Next year, hopefully, we'll analyze some of this PrEP data that we have to see if this quick start program that we've implemented in September is working. It's easy to get people started on this medication. The real challenge is getting them retained on the medication, and so that's what we got to analyze. And then the other thing we're excited about, hopefully at the end of next year or early 2024, we'll get our medical van, and so we're really looking forward to getting out in the community more and doing some outreach efforts, including STI testing and treatment, and then continue to do STI testing through our health ed program. And then lastly, leveraging our population health team to try to use data analytics to potentially target our testing and outreach for STI testing in the future. So I know that was a whirlwind. Happy to answer any questions that folks have, and if other questions come up, feel free to reach me by email.
Okay. Thank you, Dr. Jenks. That was very good, very comprehensive, and very easy to follow you too. So that's a bonus. So thank you for that.
Thank you, Chair
That was a lot
Jackson.
of work. Yeah. So you're right. So overall, the big picture looks like, I mean, we're always going to have some, but we're moving the needle in the right direction, it appears.
Yep.
So thank you for that. Any questions, comments?
Just one question I had.
Yeah.
I think it's been pretty well documented that there's a lot of patients who had delayed vaccinations, just normal vaccinations. What do you think is the risk of seeing upticks in vaccine preventable diseases like measles, pertussis, things like that?
So it's a huge issue. Now, measles, I just saw this week, I think it was the World Health Organization sounded the alarm that this really is a potential issue globally. Measles is so infectious that even small drops in vaccination in a community can cause outbreaks. And we certainly see this in the United States. It doesn't take much. So the level for herd immunity for measles is low to mid 90s. And so you really need the majority of the population vaccinated. So I think that is a huge risk. Polio, we've seen an outbreak in New York State. Now the kind of level of vaccination needed to prevent an outbreak with polio's in the mid 60s. We are well above that in North Carolina. So I think the risk of like a polio outbreak here is pretty low, but this is certainly an issue. I mean, vaccinations is something that, you just gotta continue to keep those numbers up, or there's always a risk of an outbreak of these vaccine preventable diseases. So, that's one thing. And that was really the impetus for this medical van that we're getting next year, because we were seeing drops in vaccination rates among school children. And that was, really one of the big issues, is getting this van so we can try to vaccinate that population. And, we've also, come up with other good uses for that. But yeah, it's a good question. And it's a big consideration.
Great, thank you.
Yep.
Okay. Thank you. Any other questions or comments? All right. If not, thank you again, Dr. Jenks. You and your team.
Jackson.
Thank you. Okay, so Ms. Miller, state of the county health.
Good evening, everyone. And if I may share
Hello.
my screen. The ability to share it just yet. Okay, is everyone able to see my screen?
Yes.
Yes. Great. Good evening. My name is Bria Miller, and I'm the Partnership for Healthy Durham Coordinator. And it is an honor to be before you, Board of Health. And I also want to acknowledge all of the Department of Public Health leadership and my director and direct supervisor, Marissa Mortaboy. This evening, I'm going to go over some things about the county health rankings and looking at where Durham is ranked amongst other counties in North Carolina. And I'm also going to highlight some data points from the 2021 State of the County Health Report. I also am going to keep this brief, but I'm open to answering any questions at the end. Okay, so looking at county health rankings. So the county health rankings and roadmaps is a program from the University of Wisconsin Population Health Institute. I did forget to mention that I am a part of the population health team here at Durham County Department of Public Health. But with this model, we are looking at policies and programs that lead to health outcomes and therefore health factors and therefore health outcomes. So we are looking at the length of life as well as the quality of life. This framework provides data, guidance, and examples of health data and equity, and it uses over 30 measures to evaluate health outcomes and health factors. So the importance of the county health rankings data. Many counties across the country utilize this data to help drive policy decisions and to find root causes of health disparities. This also helps us to bring actionable data to communities. It helps them to identify changes and opportunities for local health departments, and we'll look at some of the opportunities in just a bit. Also, it shows health disparities, and they're identified by collecting data by race and also in some cases gender, which highlights opportunities for equity paired with recommended interventions. So as we can see here, Durham is ranked amongst the healthiest counties in North Carolina, currently ranked at number 7. Health outcomes represent how healthy a county is right now in terms of length of life and quality of life. Health factors represent those things that we can modify to improve the length and quality of life for residents. Factors such as health behaviors, clinical care, social and economic factors, and physical environments are considered when defining overall health outcomes. So now looking at some areas of strength for Durham County, as you can see, access to exercise opportunities is a great strength of ours. About 87% of people in Durham live close to a park or recreation facility, compared to 68% across North Carolina. For primary care physicians, we also have a great strength. People do call us the city of medicine. So we have about 790 providers to every one resident in Durham, compared to 1,401 to one resident. 1,401 residents to one provider in the state. And then also with mental health providers, we have about 150 residents to every one provider in North Carolina, compared to 360 residents to each provider throughout the state. Also looking at areas for improvement, and I do want to mention there are more areas of strength and improvement. I just wanted to highlight a few for today's presentation. For adult obesity, about 34% of folks in Durham are obese, but this is higher than the national average of about 32%. For sexually transmitted infections, and Dr. Jenks did touch on this, we had about 908 cases of chlamydia were diagnosed per 100,000 residents, compared to 669 in North Carolina. And then also looking at the uninsured population. So about 14% of the population under the age of 65 do not have insurance, compared to about 13% in North Carolina and 11% nationally. Now looking specifically at Durham County for 2021 from the State of the County Health Report. The State of the County Health Report provides an update from the community health assessment, and the last one was done in 2020. We'll have a new one coming soon. We just completed the community-wide survey for that updated assessment. But the top health priorities that we focused on were affordable housing, access to healthcare and health insurance, poverty, mental health, and obesity, diabetes, and food access. This provides our most current data on demographics, leading causes of death, and COVID-19 cases. It also gives us information to Durham's residents to assist with grant writing, local policies, budgets, programs, and more. This was also a really good opportunity to highlight the work of other community organizations that are contributing to the health of Durham. So now looking at how this aligns with Durham County government strategic goals. So this specifically aligns with strategic goal number 2, which is for the health and well-being of all, to improve the quality of life across the lifespan through protecting the health of community, reducing barriers to access services, and ensuring a network of integrated health and human services available to people in need. So looking at Durham's demographics. Durham's population grew by 53,901, which is about 20% from 2010 through 2019. The proportions of males and females stayed the same, while the median age slightly increased from 33.2 in 2010 to 35 in 2018. Race and ethnicity is proportionate to the categories in 2019. Now looking at infant mortality rates. Infant mortality is the death of an infant before he or she reaches 1 year of life. The infant mortality rate is calculated by the number of infants who die in the first year of life in comparison to every 1,000 total births. Excuse me. So the graphs do show significant differences in infant mortality rates between races and ethnicities in Durham. The infant mortality rate decreased from 147 in the years 2010 through 2014 to 128 in years 2015 to 2019. But we still see significant inequities, especially in rates between, especially in rates with about 3 times higher infant mortality rates for Black or African American babies than white babies in both spans of time. And I did include some information about like why these inequities exist. A lot of it is due to systemic issues, lack of access to healthcare, health insurance, delayed care for mothers, especially those who are Black or African American. Now looking at leading causes of mortality. So cancer remains the leading cause of death among Durham residents, followed by heart disease. Cerebrovascular disease moved to the 4th leading cause of death from 3rd in 2018. Other ischemic heart diseases is now the 3rd lead cause of death, previously not included in the leading causes. So this part is new. Trachea, bronchus, and lung diseases are also a new leading cause of death. Rates for other races other than Black and white were excluded due to the small numbers of events resulting in unstable rates to report. And I know Dr. Jenks did report some on this, but I just don't want to include it because COVID-19 is still a major thing right now. So there were a total of 296 deaths related to COVID-19 in Durham County from March 12th, 2020 to February 28th, 2022. And this also has some information about why these disparities or inequities do exist. Now looking at life expectancy. So we see life expectancy rates are similar to previous years, still showing lower life expectancy for Black residents than white residents. Average life expectancy overall is 80.2. Now looking at some changes in data. So the first one, as we mentioned, this is covering the top health issues in Durham. And this first one is for affordable housing. So we see the median sale price of homes increased. It'd be nice if it decreased, but increased from $229,000 in 2015 to $290,500 in 2020, which is a $61,000 difference, and an increase by 27% over a 5-year span. Approximately 51% of Durham renters were considered cost burdened in 2019. During the global pandemic, the price of housing really did rise. More recent data has shown that rent increased by 39% in Durham from March of 2020 to August of 2021. And the median sale price of homes increased by 25.4% from 2020 to 2021. Then looking at access to healthcare and health insurance, the percentage of uninsured Durham residents rose from 12.2% in 2018 to 14% in 2019, meaning that approximately 40,573 Durham County residents under the age of 65 were uninsured. Now looking at poverty. So the percentage of the population below the poverty level in Durham County did decrease, as we can see here. But I did also want to call to attention that, like, while we do want poverty levels to decrease, it's important to note that part of this is impacted by the salaries of residents moving into the city. So on average, New Durham residents earn about $10,000 more than the average Durham resident. Now looking at mental health, and I did take this information from the Youth Risk Behavioral Survey to look at the percentage of students who made a suicide plan. So we saw about 12% of Black students, about 14% of Latinx students, and about 18% of white students reported that they did make a suicide plan. Now looking at obesity, diabetes, and food access. So according to data from 2017, which was the most recent data that we had at the time, about 12.9% of the adult population in Durham have type 2 diabetes. And again, we do see disparities between races, with African Americans having about 18.4% about 18.4% of African Americans having type 2 diabetes, and about 13.3% of Comunidad Latina population having diabetes, and 9.2% of the white 9.2% of the white population. There's much more detailed information in the actual State of the County Health Report, and this is available at healthydurham.org. Are there any questions?
Hi, thank you, Bria, for this presentation. I just had one question. If you could repeat one of the stats you mentioned about the patient to physician ratios.
Mhm.
What was that again?
Bring that up for you. Give me just 1 second, and I could reshare my screen if that would be helpful.
And then I also had a
That is-
second question. Oh yeah, no, go ahead.
I was just going to say that is actually 790 patients to every one physician in Durham.
Okay. And then, oh, okay. I had misheard it. So I thought we had a higher ratio than the state, but we have a lower ratio than
Lower
the
line,
state.
yes. This is
Okay.
considered an area of strength.
Okay, perfect. And then I had a second question, and this may be in the refugee presentation or maybe something that, like, a different area of Durham County government might have this data of. You were talking about the population growth areas by demographic and everything. Do we have a track of like what the refugee population growth has been in Durham?
I do not have that information, but I imagine that it does exist somewhere. I can inquire with our team to see if anyone can track that down.
Thank you, Bria. I appreciate it.
Are there any other questions?
Yeah, that's very good, Bria. Thank you so much. Quite comprehensive. I did have the toward the end there, the information about students who have a suicide plan was a bit alarming for me. And we know that through surveying students, and they.
That is correct.
Say
The
that
Youth Risk Behavioral Survey, which is done with middle school students and high school students.
Madam Chair, they touched on this a little bit earlier in the year in the presentation by Carico. And it's fresh on my mind because most recently, the NACHO chapter, student chapter at UNC Chapel Hill asked me to speak on youth mental health. And those stats are pretty alarming. They really are.
Yeah. All right. Well, we'll continue the good work. So thank you. Thank you very much for that. Any other questions or comments for Bria? All right. So agenda item 7, public health vacancy report. Still stable at 19%. We're still in the teens. So we're going to run with that. And the NOV report, love the new format. Love those pretty colors. Can just look at a glance and pretty much tell what's happening. So thank Environmental Services for that. Are there any questions or comments about the NOV report? Okay.
Well, I'll just give a little brief update. That was one of the first things I did when I got back. I met with the folks in environmental health, and we are plowing through the list. There was a complaint filed in my absence, which I'll follow up on. And we sent out at least one 10-day notice for a matter that is relatively pressing at this point. So we have to address that. But, we're slowly but surely just working through the list. Some people are in flux. There's no current violation, but they still have a few things to do to make sure that they are fully compliant. And so that's reflected in the color coordinated list. So it's coming along pretty good. Yeah, pretty good.
Great. Yeah, thank you. I know it's a lot of hard work for environmental health. So kudos again to them, and thank you for all that hard work, and you're working along with them, Attorney Wardell. Thank you. Okay. The health director's report. So yeah, I was going to comment. I was going to make that same comment about the summary sheet for dying from nutrition. That was really good because you can tell what has been done in the past year without having to doing a lot of reading. So that was great. I was going to make a comment about that, and I just did. So thanks to Health Ed for that. That's a great great program. The other one that caught my attention was the care management for at-risk children that I guess nursing and social work is doing. That sounds like a great program. I did have one question. It said that it's for children ages 0 to 5 years. So do we, after the 5 years, is there any follow-up down the road, say like at age 10 or 12 or when they get to high school? Do we have any information of how they continue to do after those first 5 years getting that extra care?
Madam Chair, I definitely would defer to Madam Director of Nursing, Hattie Wood, but I will say that I'm very familiar with those programs. Believe it or not, as a Deputy Public Health Director, I administratively supervise those programs in another county. And traditionally, what has happened is from 0 to 5, they are in CMARC, and then they can transition to another program, which is called CMHARP. And they're able to continue to monitor them. But again, feel free to correct me, Hattie, if you're on the line. But that's been my experience.
Oh, okay.
Thank you, Director. So basically, what happens because of care management for high-risk kids, they're dealing with, with the high-risk population, babies that are in a NICU, mothers that, babies that might have been exposed to drugs in utero, et cetera. And we also put in, we get referrals from the ESS, and so we, from mothers that have tested positive when they're delivering. And so we deal with this fragile group of children from 0 to 5. And then after that, we link the families to resources. Most of what we do, because if they need further resources after that, that's what our care managers do. They link them to what further resources they can get, whether it's through DPS, the school system, or kindergarten readiness, and whatever resources are available in the community. These kids are not lost because they're being followed by their pediatrician as well. And so that's how their care is continued to be given. This grant is just like Director Jenkins said, it's very specific for just that age group, because that's when when we really want to be most impactful. And we have to reach deliverables for the state and submit our data and how many clients that our social workers and nurses have touched, how much care they have given. So that's basically what that part of that program is.
Okay. All right. Great. Thank you for that. Yeah, sounds like a great program. Thank you all for that. All right. So agenda item 8, committee reports. We don't have any committee reports for this meeting, but as I mentioned earlier, we will hear from the nominating committee next month during my last meeting as chair. We'll get that report and vote then. So, and also next month, while I'm thinking about it, so actually, I'll wait for that comment. So old business, the refugee health update. Who's doing that? Chanel and Makita. So they're switching host duties.
Good afternoon.
Good afternoon.
Okay. My name is Chanel Little. I am the city nurse supervisor here at the Durham County Health Department, and I'm here alongside Makita Black. Tonight, we're going to give you an update from our April refugee health presentation. The things that we have improved on in regards to April's challenges were that we were dealing with the vaccine shortages due to the influx of refugees, as well as them not having their prior medical and vaccine records. But because we were able to work closely with our resettlement agencies, which are the World Relief, the church world services and the Lutheran services, we're able to bridge that gap. In April, we were also experiencing a barrier to the service provided. I'm sorry. Are you able to see my screen?
No.
Okay, I'm sorry, just a moment. I apologize.
No worries.
Share screen. Okay. Okay, are you able to see it now?
Yes.
Okay, I'm sorry about that. Okay. Okay, I apologize for that error. So, in April, we were experiencing a barrier due to the services provided in regards to our languages. We were unable to provide all of the services to our refugee health recipients because they weren't having all of the languages available on the line. But we have been fortunate enough to partner with our local language line that allows us to be able to schedule different appointments prior to the patients even coming into the building. So it will give them a timely service. And so they're not in our clinic too long, because usually their services that they're being seen for is a very lengthy process. We have been able to partner with Alamance County because they are not able to see refugee programs. They don't have a refugee program of their own. So enhancing our process with the coordinators, we're able to have the people that are being resettled in that county seen in our clinic by our staff. And we have been able to increase our staff, which has decreased our staffing shortage, which was a huge challenge in April. So now it's allowing us to see more appointments in our clinic. At this time, our current barrier is being able to obtain timely appointments with our partner for patients' medical assessments. And that reasoning is because they're having staffing shortages in their area. But because of this, we're still able to coordinate our policies with other counties to be able to outsource these. So up to date, we're seeing at least 17 Ukrainians in our refugee health service clinic. And we are able to see them by coordinating with the resources that we have as far as our resettlement agencies. They're coordinating everything with us. So we're getting them in and out in a timely manner, and they are acting as if this is a very good field for them. We are being able to see them with respect, and they're being able to be seen in a timely manner, which is enhancing all of the efforts that we are trying to put place here. Lastly, the additional funding that we are receiving is going to assist the refugees to be able to be referred to the tuberculosis clinic for their laboratory testing or any chest x-rays they may have to have at any point in time during their care here at the refugee clinic. I would like to thank our refugee health team, Mrs. Hattie Woods, Malkel Urainer, Makeda Black, and also Charlene Trotter, which is one of our contractors, which is not listed here, for their effortless hours and dedication to our program. We would like to thank you for just enhancing all of the aspects that we do have to offer here for our refugee health clients. I thank you. And does anyone have any questions at this time?
Any questions or comments? We appreciate that update. Looks like we're doing what we need to do, so thank you all for that.
You're welcome.
Out of those 17, how many children?
Madam Chair, I don't have that answer for you right now, but I can get that back to you.
Okay, yeah, I was just curious. Yeah, you can text me or email me later. Thanks.
Yeah, yes, ma'am.
All right, very good. All right, so further under old business, we need to review and approve our operating manual for our upcoming accreditation, which, by the way, they will be on site. I understand in January, the 25th of January, they'll be on site. So Rosalind has been working tirelessly getting all of what they need. And so one thing they're going to need is to see this reviewed again. It's almost time for it again anyway. We did it the last time, I think, in February. And thanks again to Personnel Committee for taking the lead on that back then. So it was sent to you again, and hopefully you had a time to review it one more time, so that we need to then vote. So if there are no further questions or comments about that, I will entertain a motion to approve our 2022 operating procedure manual.
Madam Chair, I had a comment.
Yes.
Excuse me.
Yes, Dr.
Madam Chair.
Braithwaite, and then Hattie.
Yes, I have that number for you on the children, if you'd like it.
Oh, okay. Okay, Dr. Braithwaite.
Okay, I just wanted to request that everyone take a look at the contact information to make sure that that is accurate. My email address is actually misspelled, and I'd like to make that correction.
Yes, thank you.
And also, Dr. Braithwaite, what I did is I revised that contact information, and I took all that information off because I did not know whether it was updated or not. So right now, the document that we're going to provide to the accreditation people will only have your name and your term on it.
Great, thank you.
Okay.
Okay, good.
And then what I can do is send that back out to everybody. I did get a comment from Dr. McDougall as well. Okay.
And along those lines, though, I've been meaning to request this every meeting, and it always slips me. But we have contact information for everyone. And for about at least half of you all, it's your work contact information. So when things come up after hours, we don't have a way to get in touch with you. And we went through this last year, and it was difficult getting everybody. So if you would please, it won't be publicized, and you don't even have to tell me. Just give Roz your cell number so that if things come up in public health after hours, we're able to contact you. And I'll check with Roz in a couple of weeks to see if you all have done it. And with the holidays coming up and people traveling, who knows what will come up, and we need to at least make you aware of things. So thank you for that in advance. Okay, so I'll entertain a motion to approve the manual.
Motion to approve.
Seconded.
It's been moved and seconded. Roll call vote.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall, you're on mute, Dr. McDougall.
Yes.
Thank
Sorry.
you. Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Commissioner Alon, Mr. Gregorio.
Yes.
Thank you.
Okay, motion carries. All right, under new business, agenda items for next week. The one thing that comes to my mind for the good of the board, and this doesn't need to be a long drawn out thing, but I don't remember previous accreditations. And so as chair, I'm not sure what to expect. So if we could just get a brief overview of that process at the next meeting.
More than happy to provide that to you, Madam Chair.
Okay. Thank you. And like I said, it doesn't need to be long and all that detailed. So any other suggestions for topic for next month? Or we'll let the staff surprise us for the new year. And don't tell them what's going to come up between now and then.
Okay, and you'll add the nominating committee, please.
Oh, that's right. Yes, that'll be a big thing.
Thank you.
For the next meeting. Okay, any other discussions for the good of the order? Oh, I did have one question for Bria. So I don't even know if she's still on. Is she? Oh, so and you may not know this off the top of your head, so I apologize in advance. But I was just curious as to the 6 counties in the state that are healthier than us.
Ooh, give me just a moment.
I know one's going to be Wake. I can tell you that.
Right.
Hearing Orange and Chatham are usually ahead. Give me just one
Okay,
moment.
yeah.
Find this for
You
you.
and see, and probably someplace in the mountain with all that clean air and hiking they do out there.
While we wait, Madam Chair, did you want Hattie to provide you with the number of children?
Oh, yes, she said she knew, just right quick. Ms. Wood?
Certainly. Thank you, Madam Chair. There were, out of the 17, there were 10 adults and 7 children that have been seen since April, Ukrainian.
Oh, okay. All right, thank you for that.
Mhm.
Bria, if you don't have that right now, don't worry about it. You can just send it to me later. Yeah, I was just curious.
Absolutely, I will certainly do that.
But that was a great presentation, so thank you again. Any other comments, questions? Okay, you all have been great this evening. Thank you for your time. You know, we're into the holiday season. I know you're busy with work and then busy with family, I'm sure. So I appreciate your time and attention and wish you all nothing but the best for this holiday season. And probably the next time I see you, it will be another year to look forward to. So happy holidays to you and yours.
Bye.
Stay safe.
Happy holidays.
Same.
Motion to adjourn.
So moved.
Roll call vote.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall,
Yes.
Mr. Curtis,
Yes.
Dr. Brightway,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Commissioner Long, and Mr. Gregorio.
Yes, and happy holidays, everyone.
You too.
Yeah.
Thank
Thank you
you,
all
guys.
for all your hard work this year. I
Thank you
appreciate
so much.
it.
Thank you.
Happy
Happy
holidays to the
holidays.
board.
Appreciates it. And to our wonderful
Thank you.
staff again. Thank you, thank you, thank you.